Hello everyone, welcome back to my channel. Today we are going to talk about dosage calculation, particularly focusing on oral medications. I know dosage calculation is kind of confusing to most nursing students, but don't worry. Today we are just going to break oral medication calculations in a way that will actually make a sense to you. So just grab your notebook because by the end of this video, you'll be solving this dosage calculation like a pro. So let's dive into it. Now, before we dive into the main video, now let's look at some things that we need to understand. We will look at basic formula for dosage calculation. Then we'll go ahead to convert units because they are very important in dosage calculation. Then we'll go ahead to know the step-by-step example of dosage calculation or how to solve dosage calculation. Then lastly, I'll give you some tips on how to avoid medication errors. All right, now let's go straight to it. So the golden formula that you should know here, for dosage calculation is D on H times V. Now, what is each of these letters stands for? Now, the D stands for desired dose. Now, this desired dose is what the provider ordered, right? And the H stands for available dose. And this is what we have on hand, okay? So what the provider ordered is the desired dose, and what the available dose that we have is what we have on hand, right? That is what the pharmacist sent to us, okay? And the V right here is the vehicle, which is the form that it comes in, which in this particular video to be the tablet or capsule, or in other way the unit that it comes in, maybe ml or mg, right? So this is what we are going to use to solve the dosage calculation or the oral medication dosage calculation right here. Now let's look at some example right here. For example, one, we have the provider orders 650 milligram of acetaminophen for pain relief. Now the pharmacy sends 325 milligram tablet. So how many tablets do you give, right? So when you get this kind of question, what we are supposed to do here is to identify the values. So first of all, let's go ahead and identify our values. Our D, which is the desired dose, right, is 650 milligram. So this is what the provider ordered. Now, when we go to our H here, this is the available that we have, the available dose, which is 325 milligram. So this is what the pharmacy sent to us. This is what we have on hand, right? And now the vehicle here is 1 tablet, right? This what we are supposed to calculate our tablet or our final answer in, right? Now the step 2 is to first of all to write your formula down, which is D on H times V, right? Now what is our D? The desired dose is 650 milligram divided by our available dose, which is 325 milligram, then times 1 tablet, right? So now when you do this, we are gonna get 2 tablets. So you can pause the video and try to put this calculation on your calculator and see what you get. You get 2 tablets, right? So our final answer is 2 tablets. So we are going to give 2 tablets to the patient. Now let's go to example 2 right here. Now example 2, we have the provider orders 10 milligram of liquid loratadine for an allergic reaction. Now the bottle label reads 5 milligram per 5 ml. So how many ml will you administer with this kind of question? So what I said first, you can pause the video and try to do this one as well. Now, what I said, first of all, what we are supposed to do is to identify the values, right? So to identify the values, so our solution right here. So D, which is our desired dose, is 10 milligram. Our H, which is our available dose, is 5 milligram. And now our vehicle, right, which the unit that it came in, right, or the unit we are supposed to give is the 5 ml, right? Now, the step 2 is to use the formula. So what is the formula? Which is the desired dose, which is D on H, the available dose times the vehicle, right? Now with this, when you do it, when you input the values that we have here, we are going to get 10 milligram divided by the available dose, which is 5 milligram times the 5 ml, right, which is our vehicle. Now when you input this in your calculator, you're going to get 10 ml, right? So this is what we are going to give it to the patient, or this is what we are going to administer in ml, right? So this is the final answer for this. Now this is the end of the calculation. There's very few examples that I wanted us to like go through. Now in our next video, we'll go more deeper into this kind of calculations. Now lastly, here are the 3 pro tips to avoid medication error. Now first of all, the first tip here is to always double check your unit, right? Always double check your unit. Now tip 2 here is to always use a calculator. Okay, always use a calculator. Even if you know the answer, try to use the calculator to double check your answer to make sure whatever value that you have there is what you are supposed to give. Okay, and the last tip here is to always label everything clearly. Okay, always label everything clearly. So you write your unit and you double check the prescription before administering the meds. Okay, now lastly, I have a question for you. So what are the most confusing part of dosage calculation that you want us to talk about? So you can comment down below and we will learn together. But in our next video, we will be going deeper into dosage calculation and be talking about more complex questions on oral medication. Now, don't forget to like, subscribe, and hit the bell for more nursing videos. Okay, now you stay smart, you stay safe, and I'll see you in my next video. Peace.